We give so much time and thought in the care of our newborns and babies. What about their skin? Are we caring for their skin correctly? Are we falling to common myths surrounding newborn skincare? Listen and find out as we talk about our baby's skin and how to properly care for them with Dr. Amin. Hi, welcome back to Project Parenthood. I am your host, Chelsea Dorsage, licensed marriage family therapist. I am here to join you on your conscious parenting journey, bringing more curiosity, openness, acceptance, kindness, and non-judgment along the way. My goal is for us to accept what is out of our control, commit to improving our parenting life, and discover better outcomes for ourselves and our family. Today, we have an amazing guest. I'm so honored to have on Dr. Mona Amin. She is a board-certified pediatrician, also the host of PedsDocTalk Podcast, an IBCLC, an online parenting educator and mother. She has been featured in the New York Times, Times Magazine, Good Morning America, Parents.com, and ABC Nightly News. Through her brand, PedsDocTalk, her goal is to provide relatable and easy to digest guidance for the modern parent regarding child health, development, and parenting. Her platform aims to guide parents in a mindful way to bring more confidence into their parenting journey. Thank you so much, Dr. Mona, for coming today.
Thank you. I'll be here with you, Chelsea. It's an honor.
Yeah, I'm so excited. So we have a special topic today. We're going to talk about, which we haven't done on the show, is newborn skin and their skincare. So I wanted to kind of dive into, just caring for our newborn skin between like cleansing and moisturizing. I know that there's so much information out there, and it can be so overwhelming as a parent to know what's right, what do we do, how do we navigate?
Yeah, and I think it's so important to remember that caring for newborn skin is important and it shouldn't be stressful or overwhelming, right? So how can we talk about skin in a whole episode, right? There is so much, like you said, there's a lot of misconceptions. There's a lot of, should I not bathe? Should I bathe? How do I bathe? How do I moisturize? And so I think it's really important because the skin is the largest organ. We forget that. People sometimes forget that the skin is a breathing, living organ, and it's the largest one we have. And from the beginning, our newborns, they have they're tiny and delicate, but their skin is especially so. So their skin is 30% thinner than our skin. That's why it's so important to care for it the best that we can. And during the last trimester of pregnancy and after birth, the skin is covered in that biofilm called the vernix that moisturizes and acts as a protective shield for your baby's skin. And it's that substance that looks white, cheesy, or creamy. And you're going to leave it on, and then it finally wears off, right? And then you're going to start bathing them. And when it does, it's important to keep your baby's skin moisturized so it doesn't become susceptible to dryness, germs, and allergens. And like you mentioned, I know there's a lot of conflicting guidelines out there on what to put on or not to put on newborn skin, but a moisturizer designed for newborn skin especially can really help the future skin concerns. So for me, one of the most ideal moisturizers is Aveeno Baby Healthy Start Newborn Wash and Balm, the regimen, because it provides that proactive care for newborn skin. And it also, when you use the balm and the wash together, it moisturizes and supports the skin barrier, similar to what that Vernix did. And the balm is clinically proven to boost hydration, which I really like as well.
Oh, wow. That's so neat. Yeah. Yes. I love Aveeno. So that's good to know. They have it's a 2-step process, it sounds like, right? For the cleansing and the moisturizing. So you get it all in one. I think I remember hearing different things every child, and even like you said, that don't bathe, because I think even with skin conditions like eczema, like my youngest had severe eczema, and I'd heard some dermatologists, some pediatricians say, no water. And then some say, no, you need to be bathing them every day. So it can be so, which way to go. I don't know if you have any thoughts on that direction.
I love that question because it's such a personalized decision, and it also just depends on the person's skin. So the American Academy of Pediatrics actually recommends delaying bathing up to 24 hours after birth to allow that vernix to remain on. So that vernix does have a lot of properties in terms of moisturization, immune properties. So we want to keep that on at minimum 24 hours. If a family wants to do it longer, that's fine, like when it naturally comes off. But when it finally does wear away or you want to take it off, that first bath is is a big deal. And you're going to start with a gentle sort of sponge bath while that umbilical cord is still on. And the key here is lukewarm water that feels comfortably warm but not hot when you test it with your elbow or wrists. Okay, so you don't want it to be too hot. And then the key with this is, if you're going to start with maybe a few times a day, and then you can build up as the skin tolerates. But one of the biggest mistakes that I see parents do is that they do the bath and maybe they use a little bit too hot of water, or maybe they forget to pat dry or moisturize after. So that's going to be a combined effect of stripping the skin of the natural oils, right? So you want to make sure you keep the water lukewarm if you're going to bathe the baby. You want to use effective products, like I had mentioned, the Vino Baby Healthy Start Newborn Wash. It's the prebiotic oat and it's gentle cleansing. And then when you wash, you're going to go neck to waist, paying attention to neck folds, ears, all of that. And then you're going to pat dry the skin after, not scrub and rub. Use a soft cotton or bamboo towel. Make sure that you pat dry, and then you're going to seal that skin in with a good moisturizer after, so that you can repeat that cycle and the skin doesn't lose moisture and subsequently get dry. And so same thing goes for eczema babies. You want to make sure that you provide that sort of nourishment for their skin and moisturization. And they may need even more moisturization because of the way their skin works and the fact that it loses more moisture. So it's really important to look at the baby's skin and see what works best for them, and also choosing the right products as well.
Okay. No, that's good to know. I think the pat dry, I think, just even if snuggling the baby in the towel, you don't have to worry about. And then I think I've always heard that, right, putting the lotion on right afterwards, the skin's going to absorb that more readily once it's still a little bit damp as opposed to completely dry.
Yeah.
Is that correct? Okay.
More so that it helps so that the skin just doesn't stay dry from the water and from that. So yeah. And I also the reason I like balms a lot, which is what the Healthy Start Newborn Balm is that it really is it's a little greasy, but doesn't leave a residue on it, on the skin. Because I know a lot of times parents will use ointments or balms and it leaves that sticky residue. This balm I actually still use for my daughter who's 18 months. And I like it too, because it's the consistency allows for that moisture to stay in without, allowing it to get too greasy or slippery, which I know some parents don't really love a lot with balms or ointments.
Yeah, I love that. Yes, because I've noticed that can definitely transfer to the clothes and all the pajamas. You notice it. Yeah. So that's really good to know. And so when we talk about newborn skin, and I love the reminder that our skin is our largest organ, because I think we forget about that. And I love the recommendation of the balms and the Vino brand. That's so good to know. And that you could probably extend it. Like you said, it doesn't have to just be for the first few months, that you could extend that as long as needed. And so in terms of skin, it can be like newborn skin. Would you say that all newborn skin is pretty sensitive, and that, that we have to be mindful of what we're putting on it or what we're using to cleanse it?
Yeah, I will say that some kids are going to be obviously more in the spectrum of being more sensitive versus less sensitive, but baby skin, because it's 30% thinner, what I mentioned at the beginning, it's going to be a little bit different, right? There's going to be more irritation that can happen. And the example and personal anecdote is that I'll have parents come in and then they'll hold their baby with their hands, and then they'll hand them to me, and all of a sudden there's little rash on their skin, on their baby's skin. And they're like, what happened? I'm like, oh, it's probably just from the natural oils or the things that you may have on your hands, whether it's lotions or your natural oils or any ointments or perfumes. And then the skin breaks out and then it goes away. But that's just a good example of the skin being more sensitive than our skin, right? Even for adults, some of us may have more sensitive skin than others. Right. And so it is nice to know that there are products out there and there is a regimen there that you want to support that baby's sensitive newborn skin, because it is, I think, across the board something I commonly see. And then as they get older, depending on the baby, you're going to see less of that, those blemishes or rashes sort of break out, right, depending on the skin history and what's happening with that child.
Okay. No, that makes sense. So yes, it's definitely an individualized, and just kind of making note of how your baby's skin reacts and knowing it might be a little bit more sensitive or it might not. And just obviously, again, given the fact that it's 30% thinner, it's going to play a role in what it's able to handle. And are there any things in general or good to know that parents to avoid on putting on a newborn skin?
Yeah. So when it comes to products, right, I think one of the biggest things that parents I think parents tell me is that they want obviously quote unquote safe products. They want products that are gentle or products that are, better for the baby's skin. So I do think it's important to be mindful of the ingredients in baby products because we know that, like you said, that newborn skin is sensitive. And it also can be sensitive to soaps, fragrances, detergent, dyes that maybe an adult skin may not be, have an issue with. So it's really important to sort of look for products that are geared towards children and babies that don't have any fragrances in it, no added dyes or anything like that, which can really help. And so again, using products that work. And one of my biggest tips is when you're starting a new product, just because it works for you, I don't want to say that it'll work for everybody. So I like, I'm partnering with Aveeno right now because I love Aveeno's line of products. I do see it work for a lot of my families. But that being said, test it on an area. I think you'll be surprised as to how amazing it works. Most of my families, like I said, love using it for themselves as well. But you want to find those types of products. I also find that if your child has more sensitive skin, using products with either oat or colloidal oatmeal can help moisturize the skin and strengthen that natural skin barrier function even more so. So it's something to consider. If your child has very severe eczema, it's always good to speak to your clinician about the best ointments for your child based on their clinical picture, how severe the eczema is, so that they can get more curtailed guidance, just because their skin is more on that higher level of degree of sensitivity if they're a moderate to severe eczema patient.
Right. And I love the recommendation about the oatmeal too, because I know Aveeno we use those at our house, the bath that you could put in the bath. It coats their skin. Those always worked well. I think that it's, yes, obviously going to the doctor for any specific or high needs. And yes, fragrances. I think that's a hard one that I feel like these days people just want to throw in everything. So it's definitely good to know to keep that in mind. And you said detergents, like we're not just talking about moisturizing and cleansing, but we think about the clothes we're putting on because that's touching all areas of their skin. So it's the first thing in contact with their skin. So just to look at that with the detergent too. When we're testing their skin, I think about how we do that when we're treating our carpets or whatever, right? It's always test a patch, right? So would we like test the inner forearm or, inner wrist with a baby, or is there a good spot that we would just kind of put it on one part of them?
Yeah. Well, knowing when you look at the skin, even on ourselves, right? Our face skin is going to be more sensitive than maybe our arm skin or our groin skin, right? I mean, that's definitely because even in an adult body, the skin is going to be different thickness. So looking at a baby, there's going to be, knowing that their skin is already thinner, their facial skin is going to be much thinner than the skin of their arm. So you can patch test a small area on their cheek is what I usually recommend. And patch testing is, again, just to make sure a few times, how is their skin reacting to it? And if it is usually something like Aveeno, it's probably going to be okay, in terms of their like not having any reaction. But you can do it for a few days, see if they tolerate it well, and then you can do it as you want to their whole body. That's kind of a way that you can approach that, but there isn't like a definitive, you must do it like this. But yeah, a face is going to be your best bet. And that being said, for little babies like newborns, I would really touch base with a clinician on putting moisturizers on faces, because although I think moisturization is great, I'm really talking about more of the body. So if it is like a under 3-month-old and you're like, oh, their skin is a little bit dry on their face, I would really make sure you talk to the clinician, because typically I don't like too much moisturization on the face because that can inadvertently sometimes cause more breakouts. So we want to make sure that we balance the different skin types across the body, and maybe do the body, the patch testing can be for anything going on the face to make sure it's not too sensitive there. But you can approach it that way.
Okay. Oh, that's good to know. Yes. I know that's common with the babies too, the breakouts on their skin.
Yeah.
Okay. So we've gotten best practices for kind of cleansing and moisturizing, testing and sensitive skin, eczema, what kind of to avoid. Anything else that maybe especially with new parents or that we're kind of, you want to make sure they go home keeping in mind, whether it's something to reach out to you if something comes up or just general knowledge?
I love it. I think one of the biggest things, since we're talking about newborn skin, there's obviously many different skin conditions that newborns can experience, but one of the biggest things I see is eczema. And I know we alluded to eczema in terms of like a little bit of, skincare, but knowing that, the exact cause of eczema is not not known, right? We don't have like one thing that we say, okay, this is it. And I think you mentioned that you had children with eczema.
Yes, all three of mine. My youngest is still, my 5-year-old is definitely still dealing with it.
Yeah, and eczema in itself can be its own road to navigate, right? And there's so many different things. Is that it could be related to the impaired skin barrier function that I mentioned, right? The dry, like they don't hold in moisture as much and they lose moisture more. Environmental allergens or products, like we mentioned, or genetics. And there's no cure, but eczema symptoms can be managed with good moisturization. So the itching, the dryness, the inflammation. The idea here for all babies, especially our eczema babies, we want to make sure that we're allowing them to have a good moisturizer on board. And I cannot stress this enough for our eczema babies, because sometimes my families will come in and they'll want the steroid cream or want something else. And I say, what are we doing for maintenance therapy for the eczema? And, you asked that great question about every baby has different sensitivity of skin. If your baby has is more prone to getting dry skin or more prone to having sensitive skin, you want to make sure that you are staying on top of moisturization more, right? After baths, you want to pat dry. You want to add those layer of moisturization. The Aveeno baby eczema therapy, and I know you use the oat baths and all that. I really like their line. For babies and toddlers, it's been clinically proven to help relieve that dry, itchiness, irritated skin with eczema. And it contains that oat or colloidal oatmeal that I mentioned is really great. And if your child has severe eczema, speaking to your clinician, if this is a good option for you, is always a great thing, just to make sure that, you get the right regimen so that you're not getting as many flare-ups. Because my goal here is to prevent flares, to prevent issues by setting a good skin foundation with healthy bathing and moisturization, locking in that moisture, and then, speaking to a clinician or getting more evaluation if things are going in another direction that we don't want to see.
Right. Oh, that makes sense. Yes. And definitely, I love that. Again, on this podcast, definitely speak to your own clinician about it, because every child is so different. And we can edit this question out if it's not appropriate, but I was thinking, so especially when we get to newborns, it's easier to moisturize. Toddlers, it gets a little hairier, where no one, I feel like, especially if, there's kids that just like, I do not want lotion. Do you have any tips for, like, again, maybe there is a moisturizer that has it included, or putting something in the bath that maybe could be the next step up if you can't physically moisturize your kid after every bath, if it's too much of a battle?
Yeah. So in the bath, using products that don't dry out the skin are going to be great. So, like the Aveeno line, the Aveeno baby wash, or any of the Aveeno baby eczema products I like, so that you maybe are not going to get as dry. Now, some tips for that toddler age group, because I am a toddler mom, I had a toddler who's now a preschooler, is giving them a lot of control whenever we can. So just say you have the product and you just say it's in like a little tub, or it's in a pump, whatever you're using. But let's say it's a little tub of the Aveeno baby eczema therapy treatment. Right? So you can open the tub up, you can show them what it feels like. You can have them stick their finger inside, their clean fingers, so that they feel like they're in control of what's going on. And then you can have them put a little bit on themselves, or take it out yourself, put it in their hand, and model what it is to put on lotion. Children want to learn. They want to do good by us. And if we're giving them positive reinforcement, if we're giving them a little bit of autonomy of not just pinning them down and trying to get ointment on them, but actually showing them what it is, they're going to be less afraid, right? And then also making it part of the routine. So using my daughter as an example, or any kid, she always does that alligator roll, like wanting to get away from you when it's diaper, but talking to them, over the age of 9 months, they understand what you're saying. Yep. So saying, sweetie, I know you want to roll. I'm going to put lotion on you, or I'm going to put your ointment on you now. And we're going to go, and then I could do a little massage and I sing. And the more you do that, and the more you just make it part of your routine, the more they will show up for it. And yes, you're going to have moments that they'll be like, I don't want to do it, but you're going to say, this is part of our day. It's time to put the ointment on. And here, you want to take it. You want to put the balm on. And then you can have them have a little bit of control. So make it fun. Give them a little bit of control if you can, and autonomy. And then also just bring it part of your routine would be the 3 ways to kind of make that happen. So it's not a chore and more of part of our life.
Oh, I love that. Yes. The autonomy is such a huge piece, right? How we can creatively insert that to our child's daily life is definitely crucial.
Yeah, and it's so important. I mean, this is my platform. Like, I love raising children who understand their bodies and feel in control. But we also, with hygiene, there's some things that we have to get done, right? So I always say that caveat that, yes, I want autonomy with our children, but when it comes to brushing teeth, hair brushing, taking baths and also ointment and moisturizing, those are non-negotiables in my mind, right? They have to happen, but they don't have to be this power struggle situation.
Absolutely. I love that. Yes,
Yeah.
this is, and you can, like you said, you can still have choices. Like you can put it on or I can put it on. What's your choice, right?
Yeah, exactly.
Yeah, I love that. Anything else that I feel like I forgot to ask, or you see, I know you see all these parents with newborns on a daily basis. It's not who I see. So I'm like, I'm not sure, in case I'm forgetting anything.
I think one of the biggest things is sometimes parents will come to me in the office and they'll feel ashamed to talk about skin concerns because they think it's a cosmetic thing. Using examples of eczema, and then even later on, like I have teenagers with acne, right? But using this example, I really want to give parents this empowerment that if they are concerned about their child's skin, let's say it's eczema, let's say it's baby acne, let's say there's blemishes, to talk to your clinician, because maybe there are things or products that we can recommend. And I get this often that, well, it's just cosmetic. It's nothing serious. I'm like, even if it's not something serious, right? I get this a lot with eczema that, it's not, I'm like, it's uncomfortable. Like probably for your children, dry skin and eczema especially is not easy to deal with for the family, for the patient. It's itchy. It can cause redness and flares. So my goal is to, always give product recommendations and guidance so that we can really help bring more joy back into the parenting experience and more joy for that child. And so I'm like really happy when I get to partner with brands like Aveeno, who are on that mission as well. They are in this ballgame to really help educate and empower parents. And if anyone's listening that wants more, I actually created this newborn skincare video with them. It's Newborn Skincare 101 on a parenting platform called Motherly. So if you want more information about caring for newborn skin, you can check that out on Motherly's website or also Aveeno.com. And Aveeno Baby's line of products works from babies to older children, right? They have a line of Aveeno Kids products aged 3 to 7, which we use for our son as well. And you can check it out anywhere, Amazon, Walmart, Target, and CVS. And my podcast, final message of checking out my podcast. I don't talk about skin all day, but I do incorporate a lot of resources on my podcast and my YouTube that are free, because I really, like we're doing here, I think so much of this education and information should be free and accessible to all families, regardless of their ability to pay. And it's such an exciting thing to be able to come and talk to you and really provide this sort of foundation for knowledge for parents, but also for healthy skin for their child's life, because it's their biggest organ and I want to take care of it.
Oh, I love that. Thank you. And thank you so much. Those were going to be my final questions, was just to how people can reach out to you. And so they obviously have your podcast and YouTube, and I know you're on Instagram as well. So make sure to check you out. And I love that. I appreciate that your willingness to, I think, even validate. I think that's such a big word too for these parents, that they're not alone in a lot of these things, and that it's okay, like you said, even to bring up a little concern. It's okay to bring up a concern. There's no shame in that. It's your advocating for your child and your comfort. And like, we can know that if a child is uncomfortable or itchy, that means they're also irritable or not content and not in their best place. So I love that.
Yeah, I love it. Every time my parent comes in my office and I see something on an exam, even if they didn't bring it up, I always bring it up, not I just verbalize and say, hey, I noticed this thing on your baby's skin. I just want you to know that it's completely normal. There's nothing to do about it. Or, hey, I noticed that your child has this patch. Are you concerned about it? Is there anything, you've been doing for it? Because I do believe that, that's our job as clinicians, and parents sometimes feel scared to ask those questions. So I love that advocacy piece, because I'm a mom too. I know how scary it is on the other side. And I've been fortunate to be on both sides. So thank you for acknowledging that. That means a lot.
Of course. Well, thank you so much, Dr. Mona, for taking the time to share your knowledge.
Yes. Happy to be here with you, Chelsea. This was awesome.
That's it for this week's edition of Project Parenthood. Remember to be curious, open, accepting, kind, and non-judgmental on your conscious parenting journey. If you have any questions about this episode, about your parenting journey, and or topics you would like to hear more about, please reach out to parenthood@quickanddirtytips.com or leave a message at 646-926-3243. Project Parenthood is a Quick and Dirty Tips podcast. Thanks to the team at Quick and Dirty Tips, Holly Hutchings, Davina Tomlin, Morgan Christensen, and Brandon Getchus. May you be happy, safe and protected, healthy and strong, and live with ease.